How can I tell if my mom has dementia or not? She's been forgetting a lot lately. She's been forgetting telephone numbers that she's never forgotten. She's forgetting birthdays that she's always remembered all of her life. And the most obvious, she's gotten lost in her own neighborhood on more than one occasion. These are certainly very important areas to consider when we're determining whether or not the person could have dementia or not. The fact that you're asking this question tells me that you're afraid, you're anxious, you're nervous about the answers you're going to receive. This is a scary time to consider dementia as a condition. But before you accept dementia as a permanent fixture in your life, I'd like for you to consider these areas. Hi there, everybody. I'm Dr. Macie Smith, the social gerontologist providing caregiver coaching, education, and training to help you and your families reach the next level of care. These are very valid concerns to have about your loved one when you see that their memory loss or their forgetfulness is impacting their daily life. There are certain things you want to do in terms of building a team to make a determination if this is a progressive type of dementia or if this is something that could be addressed with diet, exercise, and or lifestyle changes. So here are 3 things you should consider when your loved one's memory loss, confusion, or forgetfulness is concerning and interrupting their daily life. The very first thing you want to do is contact the person's primary care physician, not the hospital, but their primary care physician. That person's primary care physician knows their history. So because that doctor knows the person's history, there'll be a better opportunity for a reasonable diagnosis. You don't want to go into the doctor's office as a loved one with the diagnosis. What do I mean by that? You don't want to go into the doctor's office or to the appointment with your loved one and say, "Doc, I think mom has dementia. She has to have it because she's forgetting things she's never forgotten before." Don't do that. You don't make the diagnosis. Allow the doctor to do his or her job. You just state the facts that mom is forgetting things that she used to remember. She's no longer able to remember certain telephone numbers. She's gotten lost in her neighborhood. You want to state the facts, not perceptions, not what you're thinking or feeling, but just state the facts. The doctor should do a full blood workup to make sure there are no vitamin deficiencies and there aren't other things that are jumping out as concerns. The second thing you want to do is to enlist the help of a neurologist. Dementia is typically caused by a neurological condition. Not always, but a lot of times it's caused by a neurological condition. And if it's caused by a neurological condition and if it's a brain condition, then you want a brain specialist, which would be a neurologist. So you would ask your primary care physician to refer you to a neurologist. That neurologist should do a cognitive test to determine the severity of the memory loss. And third, because this confusion and memory loss is very concerning to you, and again, it's impacting the person's day-to-day, you want to enlist the help of an elder attorney, not a regular attorney, but you want to enlist the help of a specific attorney, someone who specializes in elder law, because you want to ensure that the advanced care planning documents are in place and also what your long-term care options would be in the event your loved one has a progressive type of dementia and may need long-term services and supports. You want to be prepared for that. So be sure you contact the primary care physician so that care physician can do a full blood workup and assess to establish baseline. You want to get a referral to a neurologist so that way the neurologist can do a cognitive assessment and also brain scans. And then you want to enlist the help of an elder attorney to ensure that your advanced care planning documents and your long-term care plans are in place. For these tips and more, be sure to like, comment, and share my YouTube page. And don't forget to click the bell so that way you know when I upload a new video. Until next time,